This is Dr. Sabrina Siegel with the Neuroscience Education Institute, and I am here at the American Psychiatric Association interviewing Dr. Vahabzadeh, who's the Director of Digital Health at BrainPower. And my first question for you is basically, would you be able to tell us a little bit more about BrainPower and what it is exactly that you do as the Director of Digital Health over there?
Hi Sabrina, thank you very much for the interview. So at BrainPower, we are a neurotechnology company that is mission-driven to building innovative technologies for the autism community, targeting behaviors and targeting challenges that people with autism sometimes have. So we help them to engage in social environments, understand and recognize emotions, self-regulate their behavior, and pay attention to important social cues, such as the central part of the face, eyes, etc. So we're really driven by families and individuals and their needs to help create digital augmented reality technologies for them.
That sounds very exciting. Keeping that in mind, would you be able to tell us about a specific platform, maybe an app or a program or a specific device that is having a particular amount of success in terms of treating children with autism?
Thank you. So I think there's a lot of different innovative things that are being researched at the moment. People are using smartphone apps, for example, to target specific educational or behavioral interventions in autism. People are also experimenting with virtual reality. And our own company, we're using augmented reality. That's to say that you're looking at the real environment around you, but you're placing virtual elements in that environment to help guide the person through some of their challenges, help to make them successful in the classroom, in the workplace, in social relationships. So we're seeing a lot of different areas. I think one of the key things is that there's actually much research to be done. Some of these technologies are still new. It's important to have appropriate evidence of success, usability, feasibility, and efficacy in these areas. So I think it's still a little bit early, but we are definitely seeing smartphone apps, virtual reality technology and augmented reality technology being developed. And we're also seeing some wearable devices, for example, that help to monitor stress, for example, in some children with autism.
That all sounds very exciting. Now, I read a recent article that you published on actually using digital technology to try to help prevent suicide, and I found that really fascinating. I'm wondering if you could tell us a little bit more about that. I believe there was something about an algorithm that was able to successfully predict people who are high risk for suicide, and also a type of program that could distinguish differences in facial expressions in people who had suicidal thoughts, and I found that particularly fascinating. Would you be able to comment on that and just where the progress in the state of this research lies right now?
Absolutely. And as you know, Sabrina, the suicide is a major issue. It's a major cause of mortality in our national population, especially in some younger age groups. There are a list of different technologies that are being used to help identify, especially in research, help identify who is most likely to be at high risk of having suicide, investigating how kind of affective responses may indicate the presence of suicidal thoughts, using apps, again, to try and target and help reduce suicidal ideation or suicidal plans, suicidal thoughts. I think the challenge is it's still very early. And what we're dealing with, suicide, is such a terrible outcome that we have to be extra cautious and extra judicious in our use of technology, because we certainly don't want to make things worse. So we see a lot of different technologies, a lot of different smartphone apps. Unfortunately, some of these technologies don't seem to be very evidence-based. So while there is good research going on, it's still early. Some of the stuff that's out there is not evidence-based, so we have to be very cautious. But certainly there's a lot of interesting research that's showing that using machine learning, using large data sets, it can give us additional insights that can help us to augment the care that identify at-risk individuals and hopefully help augment the strategies and care that we use to help these individuals.
That's great. I think you touched on something that's very important in terms of just our field and the overall excitement about it in the media. I think that there may be quite a bit of apps out there that aren't necessarily evidence-based. And how would you recommend that someone could go about verifying just the validity of apps on smartphones and things like that? Would you recommend that they, research the literature or speak to professionals about this? What would you advise?
So there's a variety of things people can do. The first one to highlight is that the APA actually has a recommendation list in terms of apps that you can find on the APA website, in terms of how it recommends people kind of look at apps. It's important to see who's actually created the app. Is it a reputable source, or is it somebody that may not have the appropriate insights? And actually to find out what the apps recommend. And what is the evidence base behind that? It's actually quite difficult for many consumers, and I think hence lies the danger. If you're using an app that you're not sure if they are actually really focusing on evidence-based measures to help, you certainly don't want to find out that you're using something that's not helpful when a crisis occurs. So I think the APA has some app recommendations. It's important to look at who's created the app and whether they've done any research on the app, and also looking at other people's experiences of the app.
That's really great and very useful information. Thank you so much. I just have one final question for you, and that is basically, how can clinicians, or how would you advise that clinicians stay on top of this ever-expanding digital world in terms of perhaps the value that it might lend for patient treatment, and it's particularly the treatment of mental health? Is there any advice you have for that?
Absolutely. So we're seeing huge changes. We're seeing lots of rapidly developing technologies. There's a convergence of research and commercial organizations coming into this area. I would say remain cautious and look for evidence. And there's certainly a degree of hype around some of these different tools. And I would say it's still important, as always, as with any modality, to critically evaluate what's being said. Several psychiatric outlets, such as NEI now, and others are talking about this, producing articles about this. It's important to see who the authors of such articles are. And again, critical evaluation. There's a lot of buzz and a lot of hype, but there's also a lot of opportunity. So how do you balance that to find out what the next steps are? Look at reliable sources, speak to your trusted colleagues, and definitely get feedback from people and patients and the wider market to see what the innovations are.
Thank you so much. That was wonderful. And thank you so much for letting us interview you, and have a great rest of your time here at APA.
Awesome.
Thank you.
Thank you.